this is why we need to have the understanding of what the treatment does, how it affects the client or patient, what the physiological foundation of the treatment is, and how it can affect the existing condition, what the condition is, and how we need to act as therapists. So we need to be personally responsible for what we do, and therefore we need to focus on, as I've already said, safety aspects of colon hydrotherapy. Therefore, we don't only need to have a list of contraindications, but also understand the nature of the condition that it is contraindicated for colon hydrotherapy. So let's revisit the definition of colon hydrotherapy. It's the introduction of water into the rectum via the anus using a speculum or a nozzle which are connected to water supply, performed for medical or therapeutic purposes. I'm going to read out an incomplete list of contraindications and caution. I just want to show you the list and then teach you how to deal with it. Abdominal pain, anabolic steroids, mild anemia, severe anemia, abdominal aortic aneurysm, brain aneurysm, antidepressants, aspirin, cancer in complete remission, cancer in partial remission, colorectal carcinoma, childbirth with cesarean, natural childbirth, colitis, acute colitis in remission, cystitis, diabetes, diarrhea, acute of unknown origin, diverticulosis, diverticulitis. But remember that osis is a chronic abnormal condition, itis is an acute abnormal condition. Yeah? Anything that ends in itis, run away. Active fissures, healed fissures, active fistulae, healed fistulae. Hemorrhage in gastrointestinal tract, hemorrhoids external, hemorrhoids internal, high protein diets, controlled hypertension, uncontrolled hypertension, hypothyroidism, controlled and uncontrolled hypotension, hypothyroidism, IBD or Crohn's, IBS, liver cirrhosis, painkillers, pregnancy any term, prostatic hyperplasia, prostatitis, prostatosis, renal insufficiency, seizures, severe cardiac disease, steroid medications, street drugs, surgery abdominal within 8 months, thrombosis or phlebitis, ulcerative colitis, acute ulcerative colitis in remission, very low calorie diet and warfarin. You can't remember all that, you're not a machine. So what we need to do now is go back to the definition of colon hydrotherapy, strip all the fluff out, and see what the treatment is about technically, what technically happens. Technically, we introduce water into patient's large intestine via the anus and the rectum using a speculum or a nozzle, which are connected to a water supply. This is what we technically do. Because what's in our head, purposes and benefits and all this, that's not going to damage the client. What's going to damage the client, if anything, is that. So what do we have in colon hydrotherapy? We have some components which always stay the same, and some components which always change. Speculum or nozzle or water, they will always stay the same. Condition of anus and rectum, condition of the large intestine, and the factors affecting the patient, they change all the time. So if we look at the contraindications and cautions, we need to look at the bottom bit that changes all the time. If anus or rectum are damaged, then introducing the speculum into the anus or rectum can have a local adverse effect. If a large intestine is damaged, then introducing of water into the large intestine can contribute to that damage, and that's organ damage. If the patient has had new factors or aggravated chronic condition in their health, then introduction of water into the system might do nothing for anus and the rectum, might do nothing for the large intestine, but it will affect the neural response, the homeostasis, and the metabolic response. If we look at it in the other way, we have a local effect, which is anus and rectum, organ effect, which is the large intestine, systemic effect, which alters your metabolic response and the nervous response, and the fourth one is kind of, we don't know what we don't know. That's things that Alison has talked about. That's your gut feeling.